I am Dr. Sudha Madakasira, MD, a board-certified psychiatrist and Chief Medical Director of Sycamore Psychiatric Programs, which are located in Biloxi, Jackson, and South Haven, Mississippi. Today, I wanted to address mental health concerns surrounding the coronavirus pandemic. Our governor, Tate Reeves, recently in a press conference brought out the issue of mental health and warned about the dire consequences of loneliness and despair resulting from Covid-19 social distancing requirements. This is an important topic and timely also, considering that May is Mental Health Awareness Month. I want to tell you about a national poll that the American Psychiatric Association conducted in the later part of March that involved over 1,000 adults. What the poll found was that 48%, that's almost half, reported being anxious and about getting ill with the virus. And about 2/3, that's 62%, are worried about family getting ill with it. A lot of them, that's 57%, were stressed about the impact on their finances. And a lot more, 68%, are worried about the long-term economic impact. Over 1/3 of the poll respondents reported that coronavirus had serious impact on their mental health, and about 59% reported it was having serious impact on their lives. Some 20% reported sleeping problems, and 12% reported being irritable and getting in fights more with their partner or loved ones. The poll that the American Psychiatric Association did highlights the stress and anxiety caused by the pandemic and its effect on the mental health of the Americans. Previous studies during quarantine have shown that distress reactions are common during infectious disease epidemics. These reactions include insomnia, anger problems, appetite disturbance, a feeling of uncertainty and insecurity, scapegoating, and increased visits to doctors. There are also reports of increased use of alcohol, tobacco, and other drugs. There is also reports of increased family conflict and violence. A minority of individuals have developed anxiety and depressive disorders that need formal treatment. Interestingly, patients with the pre-existing mental disorders seem to manage adequately in the face of this challenge. However, some may get worse. Some people with obsessive compulsive disorder get worse in terms of their cleaning compulsions and wanting to isolate more to cope with the fear of the infection. Some individuals with paranoid conditions may get worse in delusions, misinterpreting the social distance requirement as a persecutory act. Let's talk about some strategies that would help you to cope and to reduce the distress regarding the virus and the social distancing. Number one, take everyday preventive measures such as hand washing, cleaning, wearing masks in public, and keeping your distance from others. These give a sense of control to you. Number two, you want to maintain your daily activities that also give a sense of control, such as going to bed and getting restful sleep on a regular basis, regular and healthy eating, and exercising. Number three, you want to limit the use of alcohol, tobacco, or drugs because those are not healthy coping mechanisms. Number four, stay connected with your friends and family and talk to your loved ones about your fears and concerns. Number five, you want to take up and practice calming strategies that are available in online. And of course, you know some of these, such as deep breathing, muscle relaxation, meditation, and other mind centering strategies such as yoga, tai chi, etc. Number six, you want to engage in enjoyable hobbies and activities such as family games, art, woodcraft, etc. And these will help you keep your mind off your worry about the disease. Number seven, you want to reduce the amount of time you spend watching the news, either on TV, radio, or social media, and you want to take good breaks from that, because watching more and more of that will only heighten your fears about the disease. Let's talk about children and teens. They are likely to be confused and stressed about the disease. They don't mind not going to school, of course, but they miss their friends, their classmates, spending time and playing with friends. They react also in terms of what they see and hear from the adults around them. Some children get irritable and cry more often, and some of them return to behaviors that they have grown out of, such as bedwetting and toileting accidents. Some teens may act out in terms of defiance and anger outbursts. Some may develop some somatic symptoms such as headaches and body pains, and some lose interest in things and start neglecting their schoolwork. Now, it's important to address these concerns and fears that children and teens have. You want to sit down with them and talk to them calmly and explain to them about the disease in terms that they can understand, and asking questions and allaying their fears about the disease. As you know, children work out their fears through play. So it's important to play with them and engage them in age-appropriate play. Engage them in family activities, taking them for walks, games, etc. And to encourage them to get into reading, art, and creative activities that can keep them away from worrying. During this coronavirus pandemic, physical health and safety are the foremost in priority, but mental health is also important. You want to take care of yourself in terms of your mental health. Coping with stress will make you, your loved ones, and the community you live in stronger. Please contact me or the counselors at Sycamore Psychiatric Programs if you need help or if you have questions. You can visit our website, sycamore.com. That's PSYCAMORE.com, or call us at 1-800-PSYCH-4U. That's PSYCH-4U. Be safe and be healthy, and good luck to you.